here are the 3 typical neck stretches that we'll go over. And the reason for doing these is stiffness from the skull down into shoulders, neck pain, headaches, there's a lot of reasons, but thinking about it is if you turn your head, let's go to the right. And if you feel pull on the right side, that's a trapezius problem, typically. If you turn your head to the right and you feel pull on the opposite side, the left side, it's a levator scapula problem. If you put your head both ways, typically it's a trapezius problem, but it's also more commonly a suboccipital problem. Or if you turn to the right and it's just across there, that's the suboccipital. So we'll go through all 3 of those. So turn your head to the right. I feel strain on the same side, the right side. I'm going to be nice and tall. Grab head with the opposite hand. Hand behind the back, because typically there's fascial components and other things into here, or other muscles that need to be stretched too. So we go straight across and then breathe in through the nose and out. Most of the time when I do these, I just say 4 or 5 big breaths. With trapezius, I'm gonna turn my eyes to the same side, which is the right side, which is gonna activate the trap even more. And you just pull straight across. Levator scapula, if I turn to the right and I feel the pull on the left side, that's gonna be the levator scapula over here. And so left side will put the hand behind the back. And on this one, we're gonna grab more behind the head than on the side of the head. You're gonna pull away, you're gonna look away, and then pull down. And again, try not to lose that through mid-back flexion. Stay tall and breathe in through the nose, out through the mouth. Most of the time, again, 4 to 5 breaths are usually what I go with. If people start counting to 10 or 20 seconds, they usually go 1, 2, 3, 4, 5, 7, and then they don't get a consistent move, and breathing is more important for stretching. Last one, suboccipital. This one, textbook is fist and pull down. I've never had luck with that, so I teach patients, get this part of your knuckles right between those 2 knuckles. Like push right on the angle of your chin, and that way you can push your head straight back. And now that you have your head straight back, we're going to create a fulcrum or a pivot angle right at the base of the skull. And then you're going to push back, pull down on the head. And again, don't lose it to flexion. Get as tall as you can and then pull down and breathe. You should feel it pulling right through the base of the skull. There, and then breathe again. And those are the 3 most common neck stretches we give. Okay.